Check one, two. Check one, two.
Good afternoon, everyone. We'll get started in just a couple of minutes. All right, good afternoon, everyone. Welcome to a hybrid meeting of the Endometriosis Working Group for the month of February. And today's meeting is a little different than our typical meetings. And so we are going to have a presentation from the Endometriosis Data and Biorepository Program, which is housed in EndoRise. We have invited legislators here today. We are currently joined by Representative Robin Comey. Thank you for being here. We are on CTN, so it is my hope that others in the building are listening and watching, and will be in and out. So with that, I'm going to turn it over to Dr. Elise Courtois, who is going to kick off the presentation. And Dr. Courtois, you just have to hit the red button on the microphone behind your computer. And then make sure your computer sound is off. Well, you're probably not on Zoom, so it's fine.
I think it is.
Okay.
All good?
All good.
All right. Well, thank you very much, Representative Gilchrist, for this opportunity to report back what we've been doing all this time. It is an honor to speak on behalf of the EndoRise team. And I'm going to be sharing the stage with Daniel Luciano, that is the other co-director of the EndoRise program and the biorepository. So it is important to go back to numbers because it really matters to emphasize why we do this. Endometriosis impacts 1 in 10 or 1 in 9 or 1 in 8. Doesn't depends on the numbers you're looking at because those are just estimation, but above 190 million individuals worldwide. It has a huge economical impact, estimated to $78 billion in the US only each year. And unfortunately, endometriosis has no cure or no effective or definitive treatment. It takes on average 7 to 10 years to get a diagnosis. And you get it at a very early age, estimated to be 27 years old on average. So we have to address this condition. It is a debilitating chronic and systemic disease that needs to be addressed. And endometriosis has many unmet needs. We know that it has been an underfunded and under-researched disease, and that led to a lot of things that we need to address. We need to understand how endometriosis begins, its etiology, how we can early detect endometriosis through non-invasive diagnostics. We need to understand how we can get better, effective treatments. We need to be able to prevent endometriosis from happening, but also from recurring. Data suggests that 58% of patients going through surgery will undergo more surgeries within 5 years. We need to improve patient support. We need to improve its awareness and education. We need to talk about this disease. We need to know and to teach the people of what it is and how we can better support patients. So thanks to State Representative Gillian Gilchrist, the endometriosis working group was funded in 2021, and we have been providing policy recommendations since 2022. I will not go into the details of the schematic on the left, but what we've been doing is bringing people together, patients, advocates, clinicians, scientists, legislators, and everyone in the endometriosis working group to form a program and to form a community that can start addressing this disease. So first, I would like to introduce the team. This is the EndoRise team that we have bring together and that is supporting this effort. Dr. Luciano, she is the EndoRise co-director and also the chair of the OBGYN department at UConn Health. KCT Mulaj, she is the EndoRise research coordinator. Michaela Murphy is a clinical research associate also involved in EndoRise. This team is based at UConn Health, and they've been partnering with the Jackson Lab, formed by Lisa Roy, that is our Director of Government and Community Relationship and External Government Affairs at JAX, Jasmina Kuljancic, that is the EndoRise Program Manager, and myself. So all together, we've been working within the last 18 months to form this program and to start addressing endometriosis in Connecticut. So going back into what was proposed and what was passed in 2023, we wanted to go back into the aims that were the body of this Public Act 2367, or an act concerning endometriosis. We had 7 aims. The first one to collect, sample, and data from endometriosis patients, to standardize procedure for collection, transportation, and long-term storage. We also aim to target a diverse population, and that is with the goal of enhancing research and translational application. We also were tasked to establish a knowledge center and to establish excellence and best practices for endometriosis sample collection and distribution. And finally, we want to understand how endometriosis impacts residents in Connecticut. So this is where we decided to form, to build this endometriosis biorepository. So just to go back into the details, this is the first public state-funded biorepository that is focused on endometriosis in the nation. We start with enrolling patients, surgical patients. We want to target a diverse set of patients that really reproduce and recapitulate endometriosis across all the diversity of presentation, but also takes in account ecosystem and cultural diversity. And we enroll those patients for surgical collection. That means that when a patient goes into a surgery, we will be enrolling those patients and collecting different set of biospecimen, blood, urine, tissue, peritoneal fluid, and data. Data are extremely important because we want to understand how biology aligns with symptomatology. We also collect data at the with the surgeons. We want to understand how the disease presents in the body and also how it may evolve in the future or not. Is it your first surgery? Do you have lesions in the same place as you had before, etc.? So this is a very comprehensive set of material. It's the biology, the biospecimen, it's the data, it's how patients are suffering or are being affected by this condition. What type of pain? Is it a cyclic pain? Is it a pain that is constant? Is it specifically located in a place? And this data is also longitudinal. That means that we are able to collect data not only at time of surgery, but 1 year, 2 year post-surgery. We want to understand how the symptomatology evolves. We also follow standardized SOPs that have been established by the Worth Effect program. So it's a World Endometriosis Research Foundation program that aims to standardize the data. It is important that we are able to share and put together data and compare what we have here in the US versus what has been collected in another country. The more data we have about this disease, the more we will understand it. And we also validate this biobank. QC is fundamental. You want to be able to develop new therapeutics and new ways of diagnosing the disease based on high quality data that really represent this condition. So QC is a fundamental part of this biorepository. So altogether, we have enrolled more than 50 surgical patients since we opened the enrollment in April 2024. And that led to, so it's a little bit outdated, about 2,000 biospecimens. So just remember that one single patient will have many different types of tissues. It will be processed in many different ways and will lead to many different types of experiments we can do. And then we store that. We have long-term storage capabilities, and we want to be able to distribute this material to improve and to promote research. And we will evaluate projects and distribute those biospecimens to improve research. This collection of samples was initially piloted and performed between Yukon Health, that is a reference center for endometriosis, and JAX, but is aimed to be expanded across the whole state of Connecticut. So by enrolling places that are located in different areas of Connecticut. So one big part of the biorepository is to establish the infrastructure. I don't want to bother you with all the details, but I want to emphasize on the complexity of the task and how much effort was put into building all the necessary steps to enroll patients, provide an anonymous way of donating tissue and data, being able to transfer those tissues and data into JAX, having all the infrastructure also to process those biospecimens. For each patient that is enrolled, we will have different days where we will receive biospecimen and data. It takes time and effort, and also how to manage those biospecimens. So LIMS system, sample management system. But we also put in place infrastructure to evaluate requests for data and biospecimen committees that will ensure that the biospecimen are used only for endometriosis research, and how they will be distributed. So this is a material transfer agreement, data transfer agreement, etc. This has been developed across this whole year. We want to be also thinking about increasing the amount of samples that can be collected. So it's a dynamic system that can be adapted to increasing sample collection. And this is important because if you think about the microbiome, for example, it would be very useful to collect fecal material or vaginal swab to understand if a specific bacteria or collection of bacteria may be important to diagnose endometriosis. So we want also to understand if we could detect genetic predisposition for endometriosis, and that could be led with saliva collection. So this biorepository is running for all the biospecimen that we have now, but will be and is being adapted to increasing our sample collection. We were also very lucky to be awarded with the congressional directed spending in 2024 to fund the infrastructure for sample processing, long-term storage, and management. This CDS award allows us to buy cold storage instrumentation, so -80 freezers, liquid nitrogen tanks, but also the very basic material that we need to perform all those tasks. That is biosafety cabinets, incubators, pipettes, and so on. So really, this has been something welcome that allows us to continue and to increase our efficiency in banking biospecimen. I also want to emphasize that we are tackling this aim to understand how endometriosis impacts the resident of Connecticut. So we have been working toward the expansion of a collection of biospecimen to other clinical institutions. St. Francis in Hartford, the IRB has been approved, the NTA is ongoing, and also at the Danbury Hospital, where we will be also collecting biospecimen very soon. This is important. We want to have a diverse representation of the population and a diversity in ancestry in our patient that are being enrolled. So one way also, in addition to have different geographical location, is to have also a way to get to all the communities. So we've been translating the consent form and the surveys in Spanish, and we aim to continue this in other languages. And finally, we want to understand a little bit more about how endometriosis impacts across Connecticut. How the finances of people being affected. Is it impacting a specific demographic population? What is the general health impact of endometriosis? And this is very preliminary data, but what you can see in this diagram below is that from 79 surgical biospecimen endometriosis cases that we looked at, about 33% have co-occurring immune-related conditions. So endometriosis is a systemic and chronic disease that also may be heavily associated with other disorders that can be addressed and characterized better. We need to understand the causality more than just the association. We need to understand how we can treat one with the other or vice versa. And this program is more than just a biorepository. We formed a broader program that we called EndoRise, or Endometriosis Research, Innovation, Support, and Education. We created a place where we have a centralized place for endometriosis resources that is called the ctendorise.org website. We have also worked towards improving the education through educative material. We have worked towards increasing the awareness of this disease by organizing community events. We have worked to improve the education of healthcare providers and first liners. That can be critical for an early diagnosis of a disease. Obviously, the biorepository, as I was mentioning earlier, and the promotion of research through dissemination of those biospecimens. And everything is really with a final aim to improve patient care in Connecticut and beyond. Daniel, do you want to continue?
Sure, thank you. And I'm sorry I cannot be there in person. So this is our website that has the centralized resource. And as you can see, our tabs for patients, researchers, providers, and then the public, just to learn more about endometriosis. And I say that management of endometriosis is a team sport. And so the endometriosis working group has proved that working as a team is how we are able to accomplish this. Go ahead, Elise. So we did have a kickoff event in June of last year, where we invited Dr. Karen Tang to speak about her most recent book, It's Not Hysteria. And we talked a lot about endometriosis at that meeting, and we also spent time working in work groups of researchers, of advocates, of educators and providers, so that we could figure out what it is that the community wants us to do as an endometriosis biorepository program, and how we can be here for the state of Connecticut. And it was an incredible event that gave us a lot of insight into what we wanted to do next over the next couple of years and what we plan to do. So we did outreach. We had educational rounds and courses. We did a CME course here at UConn. We've been reaching out to school nurses in the Connecticut Nurses Association. We've also been doing grand rounds at various hospitals, lectures at various hospitals. I did a multidisciplinary grand rounds at Middlesex Hospital, where I spoke with not just OBGYNs, but also pediatricians and family practitioners and internal medicine docs, really just to reach everyone, all the first line people. We've done community awareness and advocacy events, as well as research presentations at national and international conferences. I've been myself and Elise have been asked to be invited speakers at these events to talk about what we've accomplished in Connecticut. In fact, in May of last year, I was asked by the Endometriosis Foundation to speak about exactly what we did in Connecticut and present on that, which was pretty impressive and fun to be a part of. Go ahead next. So here's us, here's me speaking at the School Nurses Teacher Professional Development Day. This is our CME course. This was our MRI room. We also had ultrasound training room. And at that time, we invited a world-renowned endometriosis diagnostician from Europe who came to teach us about how to recognize endometriosis by ultrasound. We're going to be presenting at the Connecticut Nurses Association convention, as well as for a professional development day in Stamford for their school nurses. One of the things that my patients tell me is that they've had this pain since they were adolescents. And that makes sense, right? Because the average age of diagnosis is 27, but it takes us 10 years to diagnose them. So they're 17 when they're having these symptoms. And so maybe if we can catch this early in the schools, we can help minimize the suffering. And so speaking to school nurses and first-line doctors and professionals are going to be the way we can diagnose this early. Go ahead. We've also been distributing some educational material about the EndoRise program designed for high schoolers and college kids so that they can learn more about endometriosis. We also distributed some endometriosis nursing kits that we received from the endometriosis from EndoWhat. And we have sent that out to help teach our nurses as well. And then the public awareness and community. We did a below the belt screening and panel discussion on the movie from the EndoWhat organization called Below the Belt. We've been speaking at biomedical and technical conventions. We spoke at endometriosis awareness events and again at national conferences. And then these symposiums are what is going to help us to help patients get better. So I'm speaking again this year at the Endometriosis Foundation. We're speaking at the Endometriosis Summit at AAGL this year, which is the American Association of GYN Laparoscopists. They had a patient panel that some of the endo working group members were on to speak about what we're doing here in Connecticut. That was the endometriosis conference last May where I spoke. And then we've had many of our papers accepted to scientific meetings from the research that we have done through this program. And then finally, the advocacy and legislative efforts, which is why we're here today, right? So that we can continue to advocate for our patients and reach out to our legislators and DPH members so that we can continue getting what we need to help patients in Connecticut who have endometriosis, who are suffering from endometriosis. And, what we're doing in Connecticut is so amazing, and it's going to give us the chance to be not only leaders, but to set examples for other states. And I have had people from other states, from Washington State, in fact, ask, how did we pull this off in Connecticut? And came to an endometriosis working group meeting just to learn about how we pulled this off in Connecticut. It's that impressive, and it's getting that recognized. So thank you to everyone who supported us. And then again, social media and public awareness. We were mentioned in Science Magazine last year in June, as well as in NPR in September, and then part of the press conference with some of our working group members.
So moving forward, I think we have demonstrated that with the funding we receive, we have led to the establishment of this pilot program, and we have established all the infrastructure for the biorepository, but also the EndoRise program. So what we want now is to expand to more sites to be able to meet with the diversity and cross-section of community that we are targeting. We also would like to apply for an increased support for the staff to basically be able to process the increased volume of samples. Additionally, I think it's important to to make sure that we have all the support we need for the educational and awareness activities. We want to be able to provide more continuous medical education, a better outreach to the public, and have a higher presence in the public media. This is important. The more we talk about it, the more we will be spreading the information that we have about endometriosis. And additionally, we want to support off-site storage for sample maintenance. As you can imagine, 2,000 biospecimen is a lot of boxes, and we need to be able to store them in decent ways. And finally, dissemination of data and material is a key point, a key direction that we want to have in this upcoming month and in the renewal of this support. So I think it is critical to look at the overall picture through a partnership, an initial partnership between JAX and Yukon, now with the legislative partners. We've been able to show how federal funding, quality research, partnership with the local community and the legislation has been fundamental for the establishment of an endometriosis program and an endometriosis biorepository. We also are believers that the community impact and the partnership with the public is fundamental for this to continue. We also want to further our partnership with industries. They are the ones that can develop tools, or at least a diagnosis and therapeutics, but they need us to do that. They need to understand that we need to work with the right samples and with researchers that have done their due diligence in researching the disease. And I think this will place us at the center of endometriosis care and research here in Connecticut if we invest. So I would like to thank everyone that has been part of this amazing journey. First, all patients and the families for being so supportive in donating biospecimen and accepting to be enrolled in this program. The JAX team and the Yukon team, it is the people that are directly involved in EndoRise, but I have to say that my research team, so Jessica, Caroline, and Joshua, have been also amazing contributors. Obviously, endometriosis working group, without it, we will not be here. And the funding agencies, so the state of Connecticut, HRSA, and JAX and Yukon. Thank you very much.
Thank you so much, Dr. Courtois, Dr. Luciano, and your entire team at EndoRise. It has truly been amazing to get to watch this take shape over the last 2 years. I want to recognize that Representative Savette Constantine has joined us. Thanks so much for being here. And then do want to open it up for questions, but just want to reiterate again that we are leading the nation in this work. And for a disease that currently does not have any diagnostic tools except for invasive surgery and no treatment, to have all these samples collected and to be on the precipice of you all reaching out to these additional hospitals to get those samples just fills me with such hope for where we can go. And then I do want to recognize, we are hearing on a moment by moment basis how research dollars for health are being jeopardized at the federal level. And the funding for this biorepository is state funding. So we have a tremendous opportunity here in the state of Connecticut to build on that investment at a time when, unfortunately, those dollars are potentially going to be cut nationally. So I would love to see us continue that commitment here in the state. Would love to turn to my legislative colleagues first. Any comments or questions you have?
Yeah, thank you. I have a question. Thank you so much for your presentation, Doctor. Obviously, research is ongoing, and you said you've been doing this for about 18 months. And I'm just wondering if you had an in-depth presentation on the process that you're undertaking to do that. And how you're thinking about the future, but I'm just wondering if you have made any progress or any results on, progress on your goals or results, of what you're looking at and looking for, and how those results would transition to, tools beyond, like you said, surgery, Representative Gilchrist, and treatment.
Yeah, it's difficult to quantify the research into like specific data within 18 months, but I have to say that we've been researching endometriosis for many years now between the team of Dr. Luciano and myself. What I can tell you is that we've been really involved in going further from looking at the local impact of a disease. So what we've been doing, for example, and this is something that reflects in the way that we have done this biorepository, we're looking at the impact of the disease at the systemic level, meaning that instead of just thinking that endometriosis is a gynecological condition, we've been looking at what is happening in the pelvic cavity and what is happening in the circulation in your blood, and how that could be something very useful to first classify patients into the ones that have a more severe inflammation versus the ones that don't, and also how it could help us understand some of those co-occurring conditions that happen in endometriosis patients. So this is where our research is going. We have other researchers' activities that are around understanding the link between the immunological side of endometriosis and the innervation. We want to understand how pain is being triggered in endometriosis patients by looking at the interaction, the connection between those immune cells that are being attracted to the lesions and will basically make those nerves to innervate the lesions and basically transmit the pain. So it's a very basic research direction, but this is something that we believe will actually drive the research. So for example, in the context of how that links to the Endorise to the biorepository, we as researchers will apply to have access to those biospecimens, to have more material and more data to establish the mechanism, but also understand how that links to the symptomatology of endometriosis. If we can parallel what we see in a subset of cells circulating in your body and how that translates into an acute pain that is specific to a set of patients that, for example, have another co-occurring condition, this would be for us very useful because we can have a more global understanding, a more holistic understanding of the disease. So that is just one example. We also have been working in many other directions. So yes, the answer is we have done a lot of progress. We have used this research need to define and to build this biorepository, because those are the things we will need to go deeper into our study of endometriosis.
Thank you very much. And then, so state funding has been, and obviously we have a structure for this work, the working group. I'm wondering, so our state funding provides funds for the depository, is that correct?
Yes, so the state funds the biorepository. It does not fund the research that we do with the samples. So this is a different set of funding that we have to acquire independently. But yes, exactly.
Okay, thank you. Thank you.
Wonderful.
Thank you so much. I commend you on the work that you do. We know this is a issue that's plagued women for centuries, if not more. Particularly, it wasn't even in the public discourse until perhaps about 20 years ago when Padma Lakshmi, I believe, wrote about it. And all of a sudden, people everywhere started putting the pieces together and started thinking that this was an issue that could be solved. So thank you so much for the work that you're doing on the education side and then on the research side. I guess my issue is more on the funding side. You said that JAX received funding last April 2024. If you could explain the research funding, like how long you project that it will go for, like, because we know when you do stop cell collections and data and staffing and keeping track of all the cultures, we just can't stop collections and data and the labs. We just can't stop the labs at one point. So can you project what you might be thinking what the next 1 or 2 years looks like funding wise?
Yeah, I think we've been exclusively relying on the state funding in the first 2 years because we were establishing really the basis of what is this biorepository. This has been a pilot program to show that it was feasible, that it was something we could put together in those 2 years. Another detail is that we're not even at the end of those 2 years. So we're still technically building it. We are asking for extending to extend our support for the next couple of years because we believe that beyond just what is the pilot, we need to implement a stable structure and to continue in those aspects that we have not funded to do, or we basically need to concretize to put in place. But then I think you're right. We have to find a way in beyond the next 2 years to have partners that will help in sustaining this effort, whether it's through sample distribution or within it or within partnership with the federal funding, basically to keep up the pace, but also make sure that this is a viable program that can be maintained in time. So initially, it's exclusively state funded. It is something that we are hoping to continue in the next couple of years, but also we will try to definitely establish a strategy to have a more diverse supporting system. I also want to highlight that we received a little bit of money from the federal government for the infrastructure. We received $495,000 for pure instrumentation. So hopefully this will continue. I think if we show what we're capable of, it will definitely be, we will be in a good place to get this funding. Yeah.
Thank you both. Anyone else around the table or in the virtual room? Any questions or comments? You can just raise your hand. Okay. Well, thank you so much. This isn't our typical format, so I want to let those who are joining us on Zoom know this was a special meeting where we did it hybrid and wanted to focus on this presentation because the 2025 legislative session has recently begun. And so we are just heading into the budget process. So to let folks know, the governor released his budget last week, and it is my understanding that the funding for the biorepository has been maintained in that. And so now the Appropriations Committee of the Connecticut General Assembly responds to that budget and will have meetings and public hearings and then put out their own budget. And so it is my hope, and we'll be working to increase that funding based on what you've heard today, and we'll continue the conversations. So thank you again to everyone on the working group. We will go back to our regularly scheduled meeting in the month of March, which will be online. But thank you to my colleagues who joined us today. And again, to those doing the work at the biorepository, it truly is amazing to see this work coming to fruition. So thank you everyone for being here today. Have a great afternoon.
Thank you. Bye.
Thank you.